Signs and symptoms that you're having an ectopic pregnancy. Welcome back to the ABDOMINAL channel, where we discuss important topics related to women's health. In today's video, we will be shedding light on a serious condition known as ectopic pregnancy. We'll explore the signs and symptoms that indicate the presence of an ectopic pregnancy, along with its potential risks and the importance of seeking medical attention. So, let's dive right in. Before we delve into the signs and symptoms, let's quickly understand what an ectopic pregnancy is. Normally, fertilization of the egg by the sperm occurs in the fallopian tubes, and the fertilized egg travels to the uterus to implant and grow. However, in an ectopic pregnancy, the fertilized egg implants and grows outside the uterus, most commonly in the fallopian tubes. This can lead to serious complications and requires prompt medical intervention. Here are the signs and symptoms to watch out for. 1. Abdominal pain. Abdominal pain is a significant indicator of an ectopic pregnancy. The pain is often localized on one side of the pelvis but can spread to the lower abdomen or pelvic region. It can range from a dull ache to sharp, stabbing sensations. Ectopic pregnancy-related abdominal pain may be persistent or intermittent, and it may worsen with certain movements or activities. It's important to consider the characteristics of the pain and its sudden onset. While not all abdominal pain during pregnancy indicates an ectopic pregnancy, if you experience sudden, severe, or sharp abdominal pain, especially accompanied by other ectopic pregnancy symptoms, immediate medical attention is crucial. Prompt diagnosis and treatment are necessary to prevent complications associated with an ectopic pregnancy. 2. Vaginal bleeding. Vaginal bleeding in an ectopic pregnancy is lighter or spottier than a regular menstrual period and may be accompanied by abdominal cramping or pelvic pain. While light spotting can be common in early pregnancy, any unusual or persistent bleeding should be reported to your healthcare provider. In an ectopic pregnancy, the fertilized egg implants outside the uterus, usually in the fallopian tube, leading to vaginal bleeding. As the pregnancy progresses, there is a risk of the fallopian tube rupturing, causing more severe bleeding and potentially life-threatening complications. It's important to be aware that vaginal bleeding during pregnancy can have various causes, including implantation bleeding or other pregnancy-related conditions. However, if you experience abnormal bleeding along with abdominal pain or other ectopic pregnancy symptoms, it's crucial to seek immediate medical attention. 3. Shoulder pain. Shoulder pain, although uncommon, can be a symptom of an ectopic pregnancy. It occurs when internal bleeding from the fallopian tube irritates the diaphragm, causing referred pain in the shoulder area. The connection between an ectopic pregnancy and shoulder pain is due to shared nerve pathways. While shoulder pain alone is not typically a definitive sign of an ectopic pregnancy, if you experience unexplained shoulder pain along with other symptoms like abdominal pain, vaginal bleeding, or dizziness, it's crucial to seek immediate medical attention. 4. Nausea and vomiting. Nausea and vomiting are symptoms that can occur in some women with ectopic pregnancies. These symptoms can be similar to what is commonly associated with early pregnancy, including morning sickness. However, it's crucial to note that nausea and vomiting alone may not be definitive signs of an ectopic pregnancy. These symptoms can occur in a normal pregnancy as well, as hormonal changes can cause nausea and vomiting during early pregnancy. If you have persistent, severe nausea and vomiting, especially in combination with other concerning symptoms, it's important to seek medical attention. Your healthcare provider can evaluate your symptoms, perform appropriate tests, such as blood tests and ultrasound, and make an accurate diagnosis. 5. Dizziness or fainting. Dizziness, lightheadedness, and fainting can be significant indicators of an ectopic pregnancy. These symptoms occur due to the interruption of blood flow caused by the ectopic pregnancy, leading to a drop in blood pressure. When an ectopic pregnancy implants outside the uterus, particularly in the fallopian tube, it can cause internal bleeding. This internal bleeding can result in blood loss and disrupt the normal circulation of blood throughout the body, leading to dizziness, lightheadedness, or fainting spells. Prompt medical evaluation is vital because if an ectopic pregnancy is left untreated, it can lead to a rupture of the fallopian tube, resulting in severe internal bleeding and life-threatening complications. 6. Rectal pressure or painful bowel movements. Rectal pressure or painful bowel movements can be experienced in certain cases of ectopic pregnancy. As the ectopic pregnancy grows and expands in the fallopian tube or other abnormal location, it can exert pressure on nearby structures, including the rectum and surrounding tissues. This pressure can cause sensations of discomfort, heaviness, or a feeling of fullness in the rectal area. Some women may also experience pain or discomfort during bowel movements due to the proximity of the ectopic pregnancy to the intestines. It's important to note that rectal pressure or painful bowel movements alone may not definitively indicate an ectopic pregnancy. Other gastrointestinal issues or conditions unrelated to pregnancy can also cause similar symptoms. However, if you experience these symptoms in conjunction with other signs of an ectopic pregnancy, it's crucial to seek medical attention for proper evaluation and diagnosis. 7. Absence of pregnancy symptoms. Interestingly, some women with ectopic pregnancies may not exhibit the usual pregnancy symptoms that are commonly associated with a normal pregnancy, such as breast tenderness or frequent urination. The lack of typical pregnancy symptoms in an ectopic pregnancy occurs because the fertilized egg implants and develops in an abnormal location, such as the fallopian tube. This can result in hormonal imbalances and a different physiological response compared to a normal intrauterine pregnancy. It's important to note that the absence of pregnancy symptoms alone does not confirm an ectopic pregnancy, as every woman's pregnancy experience can vary. However, when combined with other warning signs, such as abdominal pain, vaginal bleeding, or unusual discomfort, the absence of expected pregnancy symptoms should raise concerns and prompt immediate medical evaluation. 8. Weakness or fatigue. During an ectopic pregnancy, hormonal and physiological changes occur in the body that can contribute to feelings of weakness or fatigue. The growing ectopic pregnancy, although not located in the uterus, still releases hormones that can affect your energy levels and overall well-being. The presence of an ectopic pregnancy can cause additional stress on your body, both physically and emotionally. The body's resources are diverted to support the abnormal pregnancy, which can lead to a general sense of tiredness, exhaustion, or weakness. The ongoing hormonal changes associated with pregnancy, even if it is ectopic, can also contribute to feelings of fatigue. Moreover, an ectopic pregnancy can cause complications that further contribute to weakness or fatigue. If left untreated, the ectopic pregnancy can lead to a rupture of the fallopian tube or other abnormal location, resulting in internal bleeding. This loss of blood and associated complications can exacerbate feelings of weakness and fatigue. Recognizing the signs and symptoms of an ectopic pregnancy is crucial for early detection and intervention. If you experience any warning signs, it's vital to seek medical attention promptly. Ectopic pregnancies can pose serious risks to your health and fertility if left untreated. Thank you for watching today's video. If you found this information helpful, don't forget to like, share, and subscribe to the ABDOMINAL channel for more informative content. Take care and stay healthy.